Hello everybody and welcome back. This is Dr. Mridula V. Amarnathya. So like you all know, we are actually traveling through this beautiful journey of pregnancy. So in my previous video, I have spoken to you about the first prenatal visit, right? So if you haven't seen it, please go and have a look at it. So we mainly discussed about the detailed medical examination that takes place during the first prenatal visit or the first prenatal checkup. So along with a medical examination, remember a physical examination is also important to rule out any issues within your body. Probably there are some things which you're not aware of before pregnancy. And sometimes any of those illnesses can also harm the pregnancy. It cannot be safe for the baby. Hence, it is important that a detailed medical examination is being done. So generally the first prenatal visit is the one where a detailed medical history and a detailed physical examination is being conducted. Post which the examinations are generally shorter and it's generally of a quick review unless and until you have certain complications and concerns. So stay tuned.
Your gynecologist would examine the heart, lungs, breasts and the other organs. This is mainly to look out for any disease or abnormalities that could influence the pregnancy. Followed by which you have the pelvic exam, wherein there is examination of the uterus as well as the cervix in order to determine the size of the uterus and also to ensure that the cervix is closed and not bleeding. In some cases, a pap smear is also done in order to detect any abnormal cells on the cervix. Okay, and sometimes even chlamydia infections are also being ruled out. And if it is so, then the patient would be requested to start on antibiotics. Then next coming to the blood workup. So over here, the blood type. Basically, we need to establish the type of the blood group, mainly the blood group, in case if you require any blood transfusion later on. Also checks the immunity to rubella, basically whether you've been immune to it or have you got a vaccination previously. Next, to rule out anemia. It is basically done to know whether you would require iron or any other supplements early on. Okay, antibody screening is also done. Infections such as HIV and syphilis is also being ruled out. After this, a urine analysis is done, basically to check out if there's any presence of bacteria, because if so, then you would be started on antibiotics. Presence of any proteins, because if so, then it shows that there is an indication of a kidney disease. And presence of sugar, because if it is there, then it can be an indication for diabetes.
So once all these tests and examinations have been conducted, then at the end of the examination, the doctor would give you the required medications. In case if you do not require, then well and good. Along with these medications, you will also be asked to start on the prenatal vitamins, which you will have to take on a regular basis. So make sure just before you leave, all your concerns and queries are being thoroughly clarified and you know what needs to be done. Because probably in most cases, the next prenatal checkup would be after 4 weeks. So till then, you will have to be sure that you do not have any concerns and how you need to go about it. Generally, most doctors tell you how you need to go about it till the next prenatal checkup. But in case, along with that, if you have certain queries, make sure you discuss it with your doctor. Okay? So stay safe. Bye-bye.